All right, I have that it is now 1 p.m. and I'm going to go ahead and call this meeting to order. I'm Bobby Greenberg, the chair of the Correctional Managed Healthcare Committee. This committee meeting is now called to order in accordance with Chapter 551 of the Texas Government Code Opens Meeting Act. We do have a quorum present. I have actually taken roll. Not only do we have a quorum, we have all members of the committee currently in attendance. We can see that you're in attendance because we're on Zoom instead of on a phone call, which when I took over this committee is, I think, when we started doing just phone calls. So I've never been in the room with everybody here. So at least we can now see each other, which is good. But for the record, current members in attendance, myself, Dr. Linthicum, Dr. Kaiser, Dr. Jumper, Dr. Hudson, Dr. Beeson, Mr. Johnson, Dr. Burris, Ms. Wyrick, and Ms. Irwin. And I believe everyone should be on. They were at some point. Hopefully no one fell off. Quick reminder that this meeting is being live streamed on YouTube Live. Also, it is being recorded. If you would make sure that you are muted if you're not speaking so that we can avoid any background noise. We did have the request out there for public comment for anyone who was wanting to sign up for public comment. No one signed up for public comment prior to the start of this meeting. In way of introductions, I would like to introduce a new member, Miss Michelle Irwin. And I'm sorry, I'm looking around on the pictures here. I thought there she is. Michelle Irwin is the Deputy Associate Commissioner for Medicaid and CHIPS Policy, is taking the place for Dee Budgewater, who is no longer with the State Medicaid Office. She is a non-voting member of the committee, and we like to welcome her. Ms. Irwin, I'm going to put you on the spot if you have anything you would like to say, but we welcome you to the committee. All right, and I'm looking at the chat and it looks like Dr. Hudson has to evacuate the building. So he will be off of the meeting temporarily. All right. Going to jump into some recognitions. Last year we had 3 employees that were recognized for the years of service. Unfortunately, because of the pandemic and the meetings, we were not able to formally recognize them before their departure. They were given plaques. The people who retired are Dr. Guillermo Garcia from Texas Tech. He was Director of Behavioral Health Services. Mike Jones from Texas Tech, the Director of Nursing Services, and Dr. Susan Morris, UTMB Regional Medical Director. So like to recognize them now. Unfortunately, we were not able to recognize them in the usual fashion, but they're have been given plaques. Additionally, if you remember, this committee previously decided that we would recognize all the bedside caregivers for the incredible amount of work and dedication they have shown during the COVID pandemic. Because of that, there were 99 resolutions that have been signed by myself, by Dr. Linthicum, Dr. Murray, and Dr. DeShields. And by the way, Dr. DeShields has the prettiest signature I've ever seen for a doctor. So I guess she said her husband can't read it, but it's a pretty signature.
Thank you, Dr. Greenberg.
Certainly. But for the record, I actually would like to take the time and read this resolution so that it is memorialized. So, and let's see if we can do this real quick. This is sort of what it looks like. It is on, this is on paper, but it's on parchment. It was, I guess, 8.5 by 14. So it was on a legal size. But this is a resolution of appreciation. Texas Tech University Health Science Center and University of Texas Medical Branch, correctional, managed care, nursing staff, and bedside caregivers. Whereas the novel coronavirus known as COVID-19 presented as a statewide pandemic in March 2020, prompting the governor to issue a statewide disaster declaration proclamation. And whereas later in the month of March 2020, COVID-19 appeared in the Texas Department of Criminal Justice patient population. And whereas the Texas Tech University Health Science Center and the University of Texas Medical Branch correctional, managed care, nursing staff, and bedside caregivers have since that time logged over 5 million patient encounters, including providing twice daily rounding to patients in medical isolation and medical restriction. And whereas the Correctional Managed Healthcare Committee, the CMHCC Joint Medical Directors, and the Texas Department of Criminal Justice Health Services Division wish to gratefully acknowledge the contributions and steadfast care provided to the Texas Department of Criminal Justice patient population. And therefore be it resolved that the Correctional Managed Healthcare Committee, the CMHCC Joint Medical Directors, and the Texas Department of Criminal Justice Health Services Division present this resolution as an expression of our sincere appreciation for the correctional, managed care, nursing staff, and bedside caregivers in the Texas Tech University Health Service Center and the University of Texas Medical Branch for their professionalism, dedication, and outstanding service to the patients of the Texas Department of Criminal Justice. And it was presented this 22nd day of March 2021 by the Correctional Managed Healthcare Committee, the CMHCC Joint Medical Directors, and the Texas Department of Criminal Justice Health Services Division. So there are 99 of those that are signed and being delivered, and thank you. And we will do an air clap for that. All right. So I'll actually call on the medical directors quickly. Is there any introductions or recognitions since our last meeting? Start with Dr. L. Dr. Linthicum, got anything?
I don't have any for my particular division, but I would like to acknowledge and recognize the presence of our 3 chief nursing officers who are in attendance at the meeting. The 2 chief nursing officers for UTMB are Mr. Kirk Abbott and Mr. Justin Robinson. And for Texas Tech University Health Sciences Center is Ms. Carrie Culpepper. So I don't know if we could get them on camera, but we would like to just reemphasize and express our gratitude for the outstanding work that nursing has done during the pandemic. We absolutely could not have made it without them and their efforts, and they've worked tirelessly, as you can see by those large numbers, over 5 million encounters. And so they have truly lived up to being the backbone of the correctional healthcare system. And so I personally and professionally want to thank the nursing leadership and all the line nursing and allied nursing staff for their efforts in getting us through the pandemic.
All right, thanks, Dr. L, and thanks for bringing my attention that they are on Zoom. So I see Justin, you had unmuted.
Yes, sir. And thank you, Mr. Chairman and Dr. Linthicum for this recognition of the hard work of the nursing staff on the front line throughout these TDCJ facilities during this pandemic. You know, their diligence and bravery facing this virus has not come without sacrifice, as we've lost several employees due to COVID-19. And as mentioned to date, nursing services just on the UTMB side now has reached that 5 million encounter point for screenings of medical isolation and medical restriction. And of course, this couldn't be possible without the support and teamwork of our other healthcare disciplines by jumping in and assisting with those screenings. And lastly, you know, we also want to thank our TDCJ partners for their ongoing collaboration and coordination of providing patient care. So thank you very much.
Thanks, sir. And is that Mr. Abbott there with you?
Yes, sir. Yes, sir.
Yes, sir.
Thank you. And to build on what Justin was saying, as of today, we've done over 15,000 vaccines in the UTMB sector. This year will mark my 25th year of service with UTMB's Correctional Managed Care program. As you can imagine, in that time, I've experienced many challenges. However, their cumulative efforts pale in comparison to what our system has experienced over this past year. As a nursing leader, I too owe a debt of gratitude for which I'll never truly be able to repay to our nurses especially, but as well to our fellow disciplines, whom without their efforts and teamwork, these phenomenal stats shared earlier would have not been possible. I'm honored today to represent this remarkable group. And for me personally, and on the behalf of our staff, we sincerely thank the Correctional Managed Healthcare Committee for this recognition today. Thank you, sir.
All right, thank you. And congratulations on your 25 years.
Thank you.
Absolutely.
Ms. Culpepper?
Yes, hi. I want to also just piggyback on what Justin and Kirk said. I want to thank you and our TDCJ partners for your support and offer my sincere appreciation for this recognition. It really is an honor to represent such a dedicated and talented and compassionate team of caregivers. And, you know, as they both said, we couldn't do this without our partners across the disciplines. And so, you know, our nurses always work tirelessly to care for our patients and for each other. And this year has just really shown their dedication and sense of dedication and really their commitment to taking care of this patient population. And so, you know, within the Texas Tech sector, we have completed just on the screenings alone, almost 1 million. And then to date, we've given just under 4,000 vaccines. So our nursing staff is an incredible group of individuals who could not do what they do every day without your support and without the support of our partners. So thank you. And again, I appreciate the opportunity to be here today.
Chairman Greenberg, I'd like to just say a few words. I mean, like Dr. Linthicum, I'd like to take this time to personally acknowledge the frontline nursing and provider staff for their heroic dedication to caring for our inmate population during the COVID-19 pandemic. Each employee exhibited a level of unwavering commitment that was not only exemplary, but meritorious. Day in and day out, our staff showed up at our units, all the while knowingly accepting the risk not only to their individual health, but to the health of their families. Unfortunately, as Justin mentioned, you know, in the Texas Tech sector specifically, you know, COVID did claim the life of one of our heroic providers, Mr. Robert Armstrong, who's a nurse practitioner, whose memory will remain in our hearts and his family in our prayers. Through millions of encounters, our staff assess, manage, and appropriately referred offenders, or inmates, assuring that each receive necessary care. To them, the Joint Medical Directors, the Correctional Managed Healthcare Committee, and the state of Texas owe an abundance of gratitude. Today, we honor each and every one of you and your staff for your devotion and selfless acts of courage. We appreciate each and every one of you, and thank you for being here today to receive this resolution.
Thank you very much. Dr. L, did you have anything else? Any other recognitions or introductions?
No, not at this time. I don't. Am I
Okay.
unmuted?
No, you're good. You're good.
Okay.
And then Dr.
Didn't know-
Shields?
Oh, sorry.
Oh, go ahead.
No, I'm sorry. I was going to say, I didn't know if Dr. Murray had any statements for the nurses, but I guess you hadn't gotten to him yet.
No,
Sorry.
no, yeah. Dr. DeShields, do you have anyone else that, any other recognitions or?
No, sir.
Okay.
Thank you.
And now we're at Dr. Murray.
Thanks so much, Chairman. Well, first, as I said, I think Lynette and Denise, you know, have said it very eloquently, you know, the impact nursing staff has had, you know, to date. I mean, I think if you really look at it, you know, this pandemic would have had a different trajectory if it wasn't for the dedication of our nursing staff. And as I said, I mean, you know, we talk about the day-to-day work that, you know, nursing staff does. And I think Dr. Linthicum always says it's the backbone of our delivery system. But this was really not only the backbone, but the heart and the soul and the brain of getting us through this pandemic. And so, as I said, I mean, as I was signing the 99 with you all, I did think about each one of the facilities and their own experience. And as I said, I mean, I think I'm hopeful we only have one pandemic, you know, under your reign. But as I said, our nursing staff did an incredible, heroic job just getting us through. So as I said, from that standpoint, you know, I can only extend my greatest thanks and appreciation for all of their efforts. In terms of introduction, Dr. L wanted me to introduce, we have a new director of IT on board. Toby Boyette came to us. He's been here a couple months now. We stole him from a sister organization, MD Anderson, down the road. He spent 15 years with them and had some free world experience outside of that. He really loved MD Anderson. And as I said, it was to our benefit that he decided that he wanted a little career change. And I think his first 3 months with us have been rewarding. He's really had some impact already on some of our facilities. You know, one of the biggest issues that we suffer from is, unfortunately, it's not IT capacity and capability. It's just being able to, in some of these locations, get enough bandwidth out there through some of these third-party providers to be able to make these systems work. And so Toby, I think with his free world understanding of IT, but also with his institutional knowledge from MD Anderson, has already made a significant impact. A couple of our facilities, Skyview had been struggling for months, and he really got them up and going. And as I said, I think, you know, he's provided some hope for us going forward, and certainly is going to give us a good direction with our IT program. So as I said, we're glad to have him on board, and I appreciate the opportunity to introduce him.
Thank you, sir. Is that him in the room with, yeah, there he is waving.
Yes, sir. Thank you. I appreciate the opportunity to be here. Loved my time, my 15 years in MD Anderson, but I feel very welcome to be here and look to spend another 15 or 20 here. So thank you so much for allowing me to be here today.
Certainly. Thank you, sir. Welcome. And then actually, Chris Blake Edwards, you are here as well. I see that you're on camera. Did you want to say anything or introduce yourself?
Hi, I'm the TDCJ Health Services Deputy Director. I work directly under Dr. Linthicum. I'm a registered nurse by training and formerly was the Director of Nursing Administration for TDCJ Health Services. I work very closely with Kirk and Carrie and Justin. I too appreciate just the enormous undertaking that the nursing staff, the frontline nursing staff had through this pandemic. It was nothing that any of us, I believe, have ever seen in our nursing careers. And hopefully we will never see it again. So I'm just very proud to be a nurse and how hard the nurses worked during all this. And they truly are the backbone of correctional nursing. So thank you.
All right, thank you. Appreciate it. All right, I think we are ready to jump in. We have some other guests, but they have a presentation later. So I'll introduce them at that point. I believe we're ready to jump into the packet that you should have mailed to you and also is available electronically. Under tab A, the consent items, which is pages, it's probably pages 1 through 76. Also electronically, I think it goes up to page 70. And those items include the approval of excused absences, including D. Budgewater from the December 9th meeting. We need approval of our minutes from the December 9th meeting. And then there's the reports from the monitoring reports from TDCJ Health Services, the medical director reports, and then the summary of the work groups. So that is a lot of information. I hope everyone has had a chance to look through that ahead of time. And I would entertain Any discussion, amendments, or a recommendation for acceptance?
Move to approve.
Second.
All right, so that was Dr. Beeson motioned, Dr. Jumper second. I like the way you did that, Dr. Jumper. That was good. Any further discussion? All right, I do not see any. Again, this is always a bit of a challenge on a Zoom type call. Unless I see somebody shaking their head, I will assume that everyone is in favor of the consent items. All right, so that motion pass. All right. Next is financial reports. Rebecca Waltz. Do I see Rebecca? Oh, there you go, right.
Can you hear me?
Sorry, I have looked around at everybody's picture a bunch of times and I just can't keep them straight. Yes, we can hear you.
Okay.
So yeah, pages 77 to 90, or again, I'm going electronic and mine starts at page 71. So Ms. Waltz, please.
So I'm presenting the first quarter of 21, the Correctional Managed Healthcare Financial Report. If you flip to page 79, this is simply a summary of our strategies and appropriations for FY21. The next page shows some population stats. This time last year, our population was 15% higher. So we've decreased by 15% over last year. And our offenders over 55 has decreased by 6% in the same time frame. This over 55 population, while it's only 15% of our overall population, it still accounts for almost half of our hospitalization costs. On the next page, our total expenditures through the first quarter was 185 million, mainly comprising of unit and site at 98. The next 4 pages are simply those that 185 broken down by strategy and by university. And then on page 86 and 87, these are select statistics and the dollars associated with those populations. And if you will, flip with me to the last page of the presentation, page 90. Our combined total of expenditures for both universities, again, is 185.4, and our projected annual projection for FY21 is 759.9 million. That leaves a shortfall of 44 million. And then when we add the amount that we moved back to 20 in order to cover 20 shortfall, that's 74.8 million. Plus, we are projecting to not collect offender health care fees because the governor waived those fees. And then we had, we closed Jester and Garza East for a savings of 3 million for a net difference of 123.7 for the biennium. And I would like to note that in House Bill 2, the introduced version, that 123.7 million is a supplemental amount. So it is in the supplemental appropriation right now, or bill. And that's the end of my presentation.
Okay, thanks. So in my understanding, again, I'm still new to the committee, is that this is how it kind of always is done, that there's always a deficit that gets addressed.
Yes,
Going forward. So, because that's a big deficit when I look at it. So
it is.
Are there any questions for Ms. Waltz?
Just a quick question for Chris. The per offender cost increased to almost 10% over the quarter. What did you see as a major driver for that?
I would say a major driver is our reduced population. So whenever you're reducing your population, you're reducing your denominator. If the numerator doesn't change consistently, then you will have an increased cost per day.
Okay.
A comment, this is John Burris. So as I read it, also just adding to that, it seems like you've not only dropped your number, but you've kept the ones that are the most expensive. So your overall number dropped by 15%, but your over 55 number only dropped by 9%.
Right.
So your per client, per inmate cost is going to get pretty high pretty soon is what I would suggest.
If I could comment on that, Dr. Barris, most of those over the age of 55 are have committed sexual offenses. So many of them are sex offenders, and many of them are also what we call 3G offenders who have committed aggravated offenses involving a weapon. So these offenders are not likely to be paroled. They're not likely to be eligible for Mr. Is, the medically recommended intensive supervision. And the trifold component of that is with them being elderly and sick, it is very difficult to establish an acceptable parole plan. And that's why many of them are not paroled, because families, do not want to accept them back. They can't care for them. There's all types of issues, housing, etc. So those are some of the reasons why that population continues to be with us, that's age 55 and older. But a large number of them are sex offenders involving indecency with children, child molestation, and also murder. Aggravated offenses with guns and knives and etc. So.
Then Dr. L, while you're at it, can you, I know that for a while, the number of inmates being transferred from county facilities had come to, I guess, a complete standstill for a bit. Has that ramped back up to the normal amount yet, or where are you at with that?
We're close to normal, and we ramped up several months ago. I believe now we're between 750 to 1,000 intakes a week from county jails. So we're pretty, we're getting close. If you look historically at our intakes, we had about 66,000 intakes a year. So we're not near that number, but we have gone from 0 to at least 1,000 intakes weekly.
Any other questions on the financial report? All right. Seeing none, actually, we will proceed on to the medical director updates. First up, I believe, Dr. L, that's you at TDCJ update, or that
Thank you. Thank you, Dr. Greenberg. Dr. Greenberg had asked each of the medical directors to add to our medical director's report and talk a little bit about the agency's response to the recent winter storm, and also to give the committee a summary of our vaccine operations. So if you will, I will speak to that after I do my medical director's report. I will try and give you a sort of a systemic overview of the responses and where we're at in terms of vaccine administration. And then my two colleagues can comment further. So my medical director's report focuses on TDCJ Health Services monitoring activities for the first quarter of the fiscal year, which are the months of September, October, and November of 2020. During that quarter, we had 8 facilities that underwent operational reviews, which are compliance audits. And the results of those audits are found in your pamphlet on pages 93 and 94. Any facility scoring less than 80% is required to submit a corrective action plan, and those corrective action plans are staffed with all members of the health services senior staff team. If we are satisfied with the corrective action, then it is accepted and is closed out. If not, we send back again asking for additional information or asking them to consider an alternate action plan. Under our capital assets contract monitoring on the top of page 95, the universities continue to do well on these audits, and we are in compliance with state regulations. Our dental quality review audit is done by our dentist, Dr. Hirsch. During the first quarter of the fiscal year, the only dental treatment received by inmates was emergency care due to the COVID-19 pandemic risk issues. And I believe we have Dr. Wood on the call with us today, and he will be summarizing some of the dental care during the pandemic. The Office of Professional Standards has both our Step 2 Inmate Grievance Program and our Patient Liaison Program. The Patient Liaison Program really functions like a healthcare ombudsman. It addresses complaints from third parties, including inmate families, advocacy groups, legislators, lawyers, just anybody other than an inmate that has a healthcare question, a healthcare concern, or inquiry. So during the first quarter, the Patient Liaison Program and the Step 2 Medical Grievance Program received 4,446 pieces of correspondences. The Patient Liaison Program received 3,499, and Step 2 grievances received 947. There were 375 action requests generated as a result of our investigations between the two programs. In the master contracts with UTMB and Texas Tech under Article 9 performance measures, each university has a performance measure of 6% or less for grievances and for sustained grievances. UTMB for the quarter was 2%. And Texas Tech was 4%. So both universities were under the performance measure cutoff. We also conduct what we call quality improvement access to care audits. During the first quarter of FY 2021, the patient liaison nurses and investigators performed 22 sick call request verification audits. And during that quarter, a total of 150 indicators were reviewed at 21 facilities, and 2 indicators fell below the 80% compliance threshold, representing only 1.3%, which is pretty good. And so we've asked for corrective action for those 2 facilities. If you turn over to page 96, our Office of Public Health. This is one area where TDCJ did not contract those functions out. We remain the primary liaison with the Department of State Health Services. We also do all of the reporting into the Department of State Health Services for those communicable and infectious diseases that are required by state law to be reported into DSHS. As you know, there is state laws that require mandatory HIV testing in TDCJ, both at intake and also pre-release. So during the first quarter, there were 9,256 intake HIV tests performed. And of that number, 55 inmates were newly identified as having HIV infection. And during that same time period, the first quarter, there were 8,161 pre-release tests performed, and 0 or none were found to be HIV positive. Also during the quarter, 517 cases of hepatitis C were identified, 293 cases of suspected syphilis, 314 cases of methicillin-resistant Staph aureus, and on average, we had 18 tuberculosis cases, pulmonary and extrapulmonary, under management. The Office of Public Health also employs a SANE nurse, which the acronym stands for Sexual Assault Nurse Examiner. And this position collaborates and works very closely with the TDCJ Safe Prisons Program. And during the quarter, this nurse reviewed 219 charts, that had allegations of sexual assault, and she found 25 deficiencies. Bloodborne exposure baseline labs were drawn on 82 exposed inmates that met the definition for lab draws. And to date, we've had 0 inmates test positive for HIV, and follow-up labs routinely obtained after a report of sexual assault. So I really don't have much to report on in terms of our peer education program. Due to the pandemic, we have not had any peer educator training at this time. So I'll move on to our Morbidity and Mortality Committee, which is a joint committee, of course, under the Correctional Managed Healthcare Committee. During the quarter, the joint committee reviewed 194 deaths. And of those 194 deaths, 2 were referred to peer review, and the peer review committee that they were referred to was the provider peer review, as you can see on the top of page 97. The Office of Mental Health Monitoring and Liaison during the quarter does several functions. One is they monitor inmates. We've gone from the term offenders to inmates, and sometimes it's hard for us to remember to use the term inmates. But they monitor inmates in restrictive housing, and they do that once every 6 months. Now, during the pandemic, we have suspended the on-site monitoring. So as things continue to improve, at some point, we will be back on site doing these direct face-to-face monitoring of offenders, of inmates in restrictive housing. Another audit that they do is they look at the access to care for mental health availability, and then also the availability of the 911 tool to be used in case of emergencies. Really, you know, if an inmate has tried to make a noose and hang himself, the 911 tool has to be in a certain place so that custody security staff can cut them down. And then the other indicator they look at was whether or not there was an appropriate description of the chief of complaint, and then a timely provider visits after referral. So 13 of the 18 units that were audited were 100% compliant. 5 of the 18, some of the indicator was not applicable. And then for those that fell below the 80%, corrective action has been requested. The Office of Mental Health Monitoring and Liaison also looks at all instances of compelled or forced psychoactive medications to ensure that inmates are, that the documentation for enforced medications is appropriately outlined in the health record. So during the first quarter, a total of 83 instances of compelled psychoactive medication administration occurred. There were 30 instances at the Montfort unit in the Texas Tech sector, 31 instances at Skyview, and 22 instances at Gesture 4. And there were no instances at the Bill Clemens unit, also in the Texas Tech sector. And so all of the documentation, all of the policy provisions were compliant in these inpatient psychiatric facilities for enforced medications. And then the last audit that they do is the intake mental health evaluation audit. And it makes sure that inmates are identified at intake that have a potential mental health need, that is actually being identified and evaluated. And this audit, we had no findings. The Office of the Health Services Liaison consists of all registered nurses. These are the nurses that do all of the intra-system medical transfers, as well as coordinate the intake of inmates with special medical or mental health needs from the county jails. So they are very, very busy. In addition to that, they do some monitoring of discharges out of hospitals and also out of infirmaries. So they looked at 259 hospital and 38 infirmary discharges from both the UTMB sector and the Texas Tech sector. And it looks like I'm missing, oh, I'm sorry. So of the 259 hospital audits conducted, 187 were from UTMB and 72 were from TAC. There were 32 deficiencies identified for UTMB and 24 for TAC. And of the 38 infirmary discharges conducted, 20 were from UTMB and 18 were from TAC. And there were 2 deficiencies identified from UTMB and 1 for Texas Tech. So we will ask for corrective action. One of the challenges in this part of our audits is that a lot of these hospital discharges are from community, it's from the community provider network. And so sometimes it's very difficult if it's not hospital Galveston to get the corrective action, but we continue to pursue it. So accreditation, I have nothing to report. During the pandemic, the ACA audits have been, many of them have been postponed. So we have nothing to report for this quarter. And then the summary of the biomedical research is there, which is also limited on page 98. And that ends my official first quarter report. Now I would like to report on the issues that Dr. Greenberg asked us to advise the committee on. Can you all still see me? It seems like I disappeared off the screen.
We can still see and hear you.
Okay, so during the winter storm that we had a few weeks ago, TDCJ began a massive preparation for it prior to the storm by dispensing food, water, fuel, and winter clothing. These were delivered to all of our units via our manufacturing, agriculture, and logistics divisions, which, you know, has massive 18-wheelers and able to move all types of inventory, food items, generators, et cetera, across the state, and they can do it fairly quickly. So all of that was done in preparation. And then during the storm, 25 facilities experienced power issues and 33 experienced water issues. Some of our medically vulnerable inmates impacted by the storm had to be moved to other facilities. Specifically, our dialysis patients, we had some issues with water and power failure, and I suspect that Dr. Murray will be reporting on that. Our facilities division staff, which includes our maintenance staff, they literally stayed on site to assist in many of these repairs. And some of the issues resulted in us having to use tankers, water tankers, to move into TDCJ facilities to provide water. Luckily, we had a lot of bottled water in reserve, and we always have lots of bottled water in preparation for hurricanes. So those facilities that had, those 33 units that had issues with water, they were able to have adequate bottled water delivered to them. And then facilities also provided, and manufacturing and logistics delivered numerous generators to units in order to basically keep the gates locked. You know, the gates in the units are all powered locked. And so to maintain custody, we had to have generator power for that. So we had lots and lots of challenges. You know, 25 had power issues, 33 water issues, but we made it through in the manner that we always do, with all the divisions pulling together and getting it done. So I'm going to switch gears and talk sort of in a general overview about where we are with our COVID vaccine administration. As you know, we've been allocated the Moderna vaccine in our system. And so as of this morning, the total allocations that's on the dashboard for TDCJ is 30,500 doses allocated to 91 TDCJ units. And to date, we still have 9 units that have not been allocated vaccine. So every unit has gotten some vaccine except for 9. In terms of overall, Texas Tech allocations have been 5,100, and they have administered 3,652 doses. UTMB's allocations have been 22,500, and they have administered 15,025. We are currently vaccinating both inmates and staff who meet the 1B criteria. And just to remind you, the 1B are persons age 65 years of age and older, or persons age 16 years of age and older with a chronic medical condition. And just to give you an overview of what those numbers are in the inmate population for TDCJ, we have 4,585 inmates that are 65 years of age and older. Of that number, the subset of inmates that are 65 years of age or older with one high-risk medical condition, that number is 2,708. And then the number of inmates less than 65 years of age with one high-risk medical condition is 29,038. So the category of age 16 with chronic medical condition, that total number for us in our inmate patient population would be 31,746. We already did our 1A group, which was our frontline healthcare staff. We've taken care of everybody, including those that are on the 9 units that did not receive vaccine. We had them travel to other units to be vaccinated. So, Mr. Chairman, that ends my report. Happy to take questions later or after the other 2 medical directors, your preference.
Well, why don't we thank you for that report again. That's I'm always impressed at how much information you have and how well you give the report. And kudos to you for your response to the weather. On the vaccinations, has there been talk that all of the inmates will become eligible at some point ahead of the other population? And
we're hopeful. We're hopeful. You know, as you know, we have to take direction from the state leadership. And so at this time, they are informing us that we can vaccinate inmates meeting 1B criteria. Okay. So we're hopeful down the line, we will be able to vaccinate more offenders. We actually, when we submitted our applications, we included all inmates in the number, as well as all staff assigned to the unit. So I'm not sure if Dr. Zepeda is on the line, but the central UTMB pharmacy staff actually submitted applications for all. At the time, we had 102 facilities. Now we're down to 99. Some were shut down, some had beds idled, but our initial applications we had to do individual applications for each facility, and we included all inmates and all staff. So I guess Dr. Murray may want to speak more about that, since Dr. Zepeda and her team were in charge of that.
Okay. Any other questions for Dr. L? Then I guess we can ask Dr. Murray in a little bit.
Well, Dr. Murray's unmuting John Burris. Are you guys in line to get any of the Johnson & Johnson vaccine, or is it going to be Moderna for you through the whole situation?
Well, Dr. Zepeda is our liaison with the Department of State Health Services in terms of the allocations. We have been told that we can request any of the three, Moderna, Pfizer, or J&J. Well, what we get is up to dishes. They decide what they're gonna send us, but we can request it. So operationally, of course, it would be much easier for us with, 120,000 plus inmates to give one shot in the arm. We'd like to, of course, exhaust the supply we have on hand. And then going forward, we had a meeting, the joint medical directors with our joint chief nursing officers. And I believe the agreement was that, the nurses are worn out. I mean, literally, you see those millions of encounters that they've done, that going forward, once we exhaust the Moderna supply, we will be requesting the J&J vaccine. So it's much easier for us to do a one-time dose than to try to go back and do another 100,000 second vaccine administration.
For sure. Thank you, Dr. Linthicum.
All right. Any other questions for Dr. Linthicum? All right. I think we'll switch then to Dr. DeShields. Do you have an update from Texas Tech?
Yes, sir. Thank you, Chairman Greenberg. Again, we were asked to bring our efforts to manage the winter storm Uri from the Texas Tech perspective. As you know, winter storm Uri produced about 8 days of ice and snow and sub-freezing temperatures across the state. During the storm, the following measures were taken to preserve critical healthcare operations and vaccine resources in our sector. We maintain essential personnel from Monday, February 15th to Friday, February 19th, essential personnel only. Routine clinic appointments were suspended. However, critical nursing functions were continued. There were no delays in ER or hospital-related care, and all of our freezers storing vaccine were checked to ensure power, and each had generator backup. Despite all of that, there were 2 units in the Amarillo area who experienced power outages. There were 3 units in the Abilene area that experienced both power and water outages. Our Colorado City unit experienced a water outage. And unfortunately, in Lamesa, the Smith unit, they experienced a power outage and a subsequent generator failure on the 16th of February. Fortunately, this was quickly identified and 86 vaccines were immediately administered to healthcare staff, TDCJ officers, and 66 offenders. So there were 0 doses wasted. As far as Montford is concerned, all hemodialysis was performed as scheduled. All surgeries that were scheduled were completed. And I'd have to say, despite all the challenges, Texas Tech and TDCJ worked extremely well together to preserve essential patient care functions and also the viability of that stored vaccine. I was really proud to be part of this team effort. Everybody came together and worked together so well. There was just outstanding communication between the two, Texas Tech and TDCJ, especially at the unit level. As Dr. Linthicum presented with regard to our vaccine, we've been allocated 5,100 doses. We've administered 3,652, I believe. So nearly 78% of the vaccines that we have received have been administered. We're moving right along with that. As Dr. Elman also mentioned, some of our units have not received allocations, but we are moving arms to the vaccine to make sure that there is no wastage. So that concludes our report and our management of this unprecedented storm in the West Texas sector.
Thank you, Dr. DeShields. Any questions for Dr. DeShields from Texas Tech perspective? All right, Dr. Dr. Murray. I did that to you, didn't I? Dr. Murray, you have a presentation or a discussion from UTMB? You are muted, sir.
How about now? Can you hear me now?
Yep, we got you now.
All right. Dr. Greenberg, I respond to anything. Owen, Murray, a lot of things. So, but I've got Dr. Zepeda down here with me. She's in the office, and I just, I think at Dr. Linthicum's request, have her give just a little bit of a synopsis, just so the committee can understand kind of the entire, A to Z process that, the TDCJ and the universities went through to get this vaccine up and going. So I'll turn it over to Dr. Zepeda, and then I'll come back and address the glacier storm.
Good afternoon. First of all, we had an extensive registration process. So we had over 100 locations that we had to register with dishes. It was not a simple registration process. We did have to provide detailed information such as the number of healthcare staff, the number of correctional officers, and the number of patients who are considered at high risk for COVID. So those are those that are age 65 or those with a chronic health condition. So after we registered those 100 locations, they considered them one by one rather than holistically. And so it took a couple of months to get all 100 locations registered. Now they're ready to go, and we can order and we can submit allocations. Again, as Dr. Linthicum mentioned, it's a request. There are 3 options you can request when putting in a allocation each week. You can order the Pfizer, which isn't practical for our setting because it requires ultra cold. And so that really leaves us the Moderna and J&J as options for our healthcare system. And again, it's based on availability. That's a request. It's not a guarantee that we actually will receive vaccine. Those requests are submitted once a week, and it's not to the by Thursday, and it's not to the following Thursday or Friday that lets us know whether or not we'll receive that allocation. So it takes about a week and a half to actually get the vaccine if approved. To date, we've had 91 units allocated 30,500 doses. And so we still have 9 units that have not received an allocation. Our university medical directors have been working very closely together to make decisions with TDCJ about who should receive that vaccine. And as vaccine has become available, more and more readily available, our criteria of who we are vaccinating has been slowly expanded. We started with our high risk, of course, our medical staff, and then our high risk employees, and have branched out again as vaccine has become more readily available.
Thanks, Stephanie. So as I said, it's been an excellent effort and combined. And as I said, there's been a lot of coordination, not only with dishes, but just internally working with TDCJ to, as I said, the big challenge is trying to align the number of doses with the number of patients we can give it to. I mean, Mr. Collier and Dr. L have been very clear about, trying to limit waste. And we've done as a system an incredibly good job. As I said, we had kind of a heroic effort at the Darrington facility several weeks back. We had a refrigerator that malfunctioned. We found the vaccine to be thawed. We went through a lot of discussion internally with TDCJ, with pharmacy, actually called the manufacturer, and finally got to a place where we had about 4.5 hours to be able to deliver approximately 800 doses. And I will say, again, thanks to the nursing staff, thanks to TDCJ, rounding up officers, as well as some high-risk offenders, we were able to get all 800 doses in people's arms before 6:45 hit the clock. So as I said, we really have worked hard not to waste any. It's created some inconveniences at times trying to, you've got people who want to get vaccinated, but yet we don't have enough to be able to constitute or reconstitute a vial and give all those doses without wasting. So as I said, the logistics have been challenging. Hopefully, as we get, more and more the opportunity to vaccinate more people, the logistics will become a little less challenging. But nonetheless, as I said, it's really been a good job so far. And I recognize, there's a lot of just political pressure and eyes on the department and what we're doing. And as I said, so far, I think we've done an admirable job with what we've been given.
All right, thank you, sir. Any questions for Dr. Murray? All right, any other comments or regarding the medical director updates?
Well, Dr. Greenberg, just one thing, as I said, you wanted just a little brief summary on the glacier storm. You know, as I said, I mean, ours kind of paralleled, you know, Texas Tech. We follow, obviously, when TDCJ closes facilities, we follow in kind. You know, we've gone through, we've had a little bit more familiarity with these weather impacts over the years. But interesting, this one was more challenging because of what happened at Hospital Galveston, and that is the city of Galveston began to lose water pressure to the extent that it really impacted the ability to get enough water pressure into the hospital, not just the prison hospital, but the entire hospital campus. Dr. Raymer and his team down there, I mean, got together at 3 o'clock in the morning and was talking about, you know, what to do if the situation worsened, to include how would we evacuate Hospital Galveston. You know, through the, you know, thankful to God that, you know, we didn't get there, but there were some real dicey moments during that time. And unfortunately, you know, the issue was, where were you going to evacuate them? Because all these hospitals in the local areas were on emergency diversion status. So it really came down to, as I said, there wasn't going to be an opportunity to evacuate. Luckily, as I said, the county and the city got together, were able to kind of fix some of the leaks and slowly but surely got water pressure back up. One of the things that, again, kind of a heroic measure that occurred was the ability to dialyze patients, of which we had quite a few in Hospital Galveston, became impacted. And so we work with TDCJ and the ward at Hospital Galveston to move those patients across the causeway over to the Carroll Young facility, where they had power and water. And they got through the 14 patients, but on the last patient, the power went off and they had to hand crank the dialysis machine to get the remaining blood back into the patient. As I said, and did it by you know, candlelight and iPhone light. And as I said, just heroic efforts on the part of both TDCJ and the UTMB medical staff to just get those patients the dialysis treatment they needed. Out in our facilities, we used almost, I think, over 400 hotel rooms, just relocating staff to areas closer to facilities. We've learned just with hurricanes and previous Arctic weather that that's just a strategy that works. As I said, that was the largest number of hotel rooms we've ever used. We ran into problems, as I said, in those communities. You got them into a hotel room, but then they couldn't get food because everything was closed. So, as I said, we're going to have kind of stepped back and have relooked at kind of our system as a whole and what we could do a little bit differently. But again, as I said, I think as Dr. Linthicum and Dr. DeShields noted, you know, we were able to get it done. As I said, you know, times of crisis are always challenging, but I will say the partnership between the three agencies always seems to rise to the top and just get things done. So, as I said, you know, we hope not to have another one. I'm sure we will, but as I said, we've learned a little bit from this one. Thanks.
All right, thank you, sir. Yeah, no, that seems to be a recurrent theme across the state, was the patients that needed to be dialyzed that couldn't be dialyzed, and then the patients who were on oxygen that lost power. And of course, the answer usually is you send them somewhere else, but everyone had the exact same problem. So that I think that caught everybody in our tracks, you know, because and even if you had somewhere to send them, you didn't have a way to get them there. So hopefully we don't have to do that again, but very impressed with y'all's response across the system. Any other questions or comments? All right, we're going to go to the next agenda item. It's a presentation from the Joint Dental Working Group. And I believe we actually have 3 of the members here, Doctors Wood, Horton, and Hirsch. And again, I keep looking at these names and then they get past me, but they're, yeah. And I believe Dr. Wood, are you going to give the presentation or?
Yes, indeed.
All righty.
Let me see if I can share a screen and get my slides up. There we go. All right. Does that look okay with you guys?
Yes, sir.
Okay. Good enough, Mr. Chairman and members of the committee. Thanks for inviting us, Joint Dental Work Group, to testify today and to give you a little bit of an idea what the status of the Dental Services Division is at this time. This is a brief summary packet, and this is what I'll be using for my testimony today. Before beginning, and with your permission, I'd like to go ahead and introduce the Joint Dental Work Group staff that are here today and available for questions later if you'd like to ask something of them. Dr. Bubba Hurst with a new hairdo. I think everybody noticed him today. He's a TDC dental director. He's been a primary source for university contact compliance for a great many years through field audits as well as chart review audits for all the TDCJ facilities. He is and has been a champion for dental care, patient advocate, dedicated professional through his 5 decades of private and public service. And we have Dr. Billy Horton, Director of UTMB Managed Care Dental Services. And he oversees roughly 3/4 of the dental clinics across Texas. Found him to be a valuable and informed colleague and a pleasure to work with. We've really gotten some issues ironed out over the last couple of years with some really nice collaboration. And then, of course, Pam Myers is not here, but she's our secretary, registered dental hygienist, and she's a UTMB hygiene coordinator. So not only does she serve as our secretary, she keeps us on track most of the time with our policies, reviews, and I don't know how we would function without her. She's been a blessing. Even though she's partially retired, I have always found her accessible and willing to come in and work with us anytime she's asked. So that's the group. In addition to that, besides the voting members, the work group can and does invite participation from our regional staff, our specialty coordinators, formulary committee, and other discipline representatives when the subject matter calls for additional expertise. And of course, we work collaboratively with our medical partners, Dr. DeShields and Dr. Murray. The overarching goal of the work group is to provide timely and appropriate dental care within the scope of recognized practice standards and, of course, specific policies of correctional managed healthcare. Our meeting format, as chartered, calls for bi-monthly in-person meetings, and typically those are hosted at the Conroe offices and frequently on the same day as we do our system leadership council meetings, and often P&T and some of the other quarterly meetings. We try to coordinate those to work out the travel so it works best for us. When it doesn't, we do remote gatherings. As have most throughout our system, we've restricted our meetings for these past 10 or 11 months to Zoom or teleconference. Due to the type of procedures typically performed in dental clinics, mostly aerosol generated procedures, it became apparent very early on in the pandemic that immediate and aggressive measures would be necessary in our field to mitigate the spread of COVID and protect our patients and workforce. So by April of last year, the work group began meeting weekly, and as of now, we continue to meet weekly, and they're Zoom meetings, so no travel involved. But I'd have to say collaboration has increased about 5-fold with those meetings. Our work group functions to provide oversight of the dental program on multiple fronts. Our scope of practice, like all healthcare disciplines, is governed by a state board and operates under Title III of the Texas Occupations Code. And within that framework, CMACC, TDCJ, and to a lesser degree, the contracted universities develop policy, review, and revise that policy, and occasionally defend that policy in litigation. As you all know, by the end of 2013, all facilities under TDCJ jurisdiction were accredited by the American Correctional Association. And I'm proud to say JDW works closely with the ACA to review audit findings, assure compliance, participate with the ACA through the dental subcommittee to develop recommended ACA standards. And we got one approved last year, a dental ACA standard, thanks largely to a group effort on that dental committee, chaired last year by Dr. Hirsch. So in addition to those functions, we do work collaboratively to improve quality measures and review monthly facility audit reports and monitor staffing requests and vacancy rates. Since the last dental presentation, I'm sure you guys remember Dr. Brian Tucker, real champion for the dental program, gave a presentation last to this committee in 2014. So it's been a while. I'd like to point out a few of the things, some of the major accomplishments we've achieved since his presentation. Some of them were his brainchild. So I'm happy to say we got those things forwarded and we're moving in the right direction. Perhaps most important, the care-centered improvement was a transition from a priority classification of care delivery to a level indicator for diagnosed needs. And at that time, we reduced the waiting times for appointments for level 3 care or routine care from 6 months to 90 days. And we reduced our level 2 or interceptive needs from 180 days down to 60 days. So we're not quite where we would like to be if you compare us to private practice, but at least we're getting these wait times down to something that's entirely respectable. The other major accomplishment was dental radiography. So far that's been implemented across the state with a projected completion for digitized intraoral radiographs expected by the end of this fiscal year. And I can say digital pantographs have already been installed at all intake facilities. And I got a little picture to share with you in a bit, and I kind of point out how important that is for us. Additionally, this past year has really seen some major improvements in PPE utilization in the dental procedures and clinics, and the rollout of air purification systems to greatly enhance safety for patients and staff when performing aerosol generating procedures. I've nothing, as you can see from this is our staffing right now. Well, it's current as of the end of January. Got nothing really remarkable to report on that front. As you can see, the dental division has been pretty fortunate to continue our operations with a relatively low vacancy rate of just under 6% total. And just for fun, I just want to share something that was shared with me from one of my colleagues in Washington State. This digital panel was taken at an intake facility on a patient who reported no pain or discomfort and no significant dental history. Like I said, it was shared with his colleague. At the time, the dental director at Washington State was making a push for his department to invest in panoramic technology for all of his intake units. And this was one of the presentations he used for that. And I thought, you know, that really kind of gives you an idea. An intraoral exam is not going to pick something like this up. It was just kind of fun. This last slide, this is the air purification system that we're using in our clinic on our side. And they are, for a small clinic operatory, have the ability to eliminate or reduce particulate contaminants of aerosol generated procedures by over 99%. So that's a big help for us, and our staff was so grateful that we got this going. And I know Billy's working on his side to get these things installed as well. As you might imagine, portable units like this was about our only option. We were not likely to see TDCJ funding a complete remake of their HVAC system. So this was the next best thing we could do. And on that note, I'll just conclude my testimony, and I'd say I'd like to thank the committee for asking us to be here, give you a little bit of update on what we're doing in dentistry. And I'm happy to entertain any questions you may have, or if you wish, you can address one of our other members.
All right,
I'll
thank you, Dr.
conclude.
Wood.
Yes, sir.
Dr. Horton, Dr. Hirsch, anything that y'all wanted to add? Okay. Sounds quiet. There's Dr. Horton.
I want to, thank Cecil for the great job he's done, and also Dr. Hirsch too. Dr. Hirsch has been with us for about, I guess, 10, 12, 13 years or something like that. And he has done an excellent job of working with UTMB and Texas Tech to increase the level of care that is provided to the inmates. So I just want to say that I have really enjoyed working with both of them, and hope to continue doing that for a long time in the future.
All right, thanks, sir. All right, any questions? Oh, Dr. Hirsch, go ahead.
No, no question.
I think we lost you. There you go. You're back again.
Oh, I was just playing with the mute, sorry.
Okay. All right. Any questions from the committee to any of our dentists? All right. I appreciate that report. And before we are actually coming towards the end of our agenda, I did want to, I guess, remind the committee that there were reappointments done. I believe it was last week. Dr. Burris and I were both reappointed till 2025. And then, thank you. And then Dr. Diego de la Mora, who is at El Paso, he's the CIO and assistant professor at El Paso, has been appointed. And I believe he will take over once he's confirmed, and he takes over for Dr. Hudson, is my understanding. So Dr. Hudson, you're going to be rotating off. I appreciate your service. Sorry we have not had a chance to have this committee meeting in person since I've been on, but thank you for your service. So we'll see. I assume the Senate will be able to confirm that prior to our next meeting. And our next meeting is scheduled tentatively to be in person June 16th in Conroe. We will see if that occurs or not. It's likely to be a Zoom, but maybe in person. So any other comments? Any committee members wish to make any remarks?
Dr. Greenberg, John Burris here. Just congratulations to you as well on your continued work with this committee.
Thanks,
and
sir.
Dr. Hudson's been great working with you, and I hope everything is okay in your building. I see you outside now. I don't know what happened, but I hope it's just a drill.
Just more of this year happening.
Yeah, and we thought getting 2020 over with was going to take care of it, and so far it hasn't.
Dr. Greenberg, I would just like to say on behalf of TDCJ, we'd like to thank Dr. Hudson for his years of service on the committee. And we will be following up with him with a plaque or a gesture to show our appreciation. Thank you.
Thank you. All right. I believe that concludes our agenda. So unless someone would like to continue to meet, we can have a motion to conclude.
So moved.
All right. Somebody give me a second. We're all done. There we go. Dr. Jumper did it again. So the peace sign. I like that. All right. Thank you, everybody. And we will meet again in June. Thanks. Bye.
Well done, Dr. Greenberg.
Thank you, Dr. Greenberg.
Sure.
Thank you. Bye.